Many people don't realize it, but if you're taking medication to relieve allergies, help you sleep, calm anxiety or depression, or manage an overactive bladder, there's a chance that these seemingly harmless remedies may be quietly raising your risk of dementia. Studies have shown that using some of these medications every day for just 1 year can increase your risk of cognitive decline by as much as 50%. That's an alarming statistic, and the implications are significant, especially for older adults and those already concerned about memory issues. These aren't experimental or rare medications, they're everyday drugs that many keep in their homes. So let's explore exactly how these medications work, which ones are most concerning, and importantly, what safer alternatives exist so you can protect your brain health without sacrificing relief from common symptoms. At the root of this issue is a class of medications known as anticholinergics. The name refers to their action. They block acetylcholine, which is a critical neurotransmitter in the brain. Think of acetylcholine as the brain's spark plug. It helps neurons talk to each other, plays a vital role in forming new memories, maintaining attention, and even regulating muscular movement. When we use an anticholinergic drug regularly, it's like putting a wrench in the communication system. Over time, these wrenches can weaken neuronal connections and impair the brain's capacity for memory and cognition. What makes the situation so concerning is that many anticholinergic drugs are used for everyday conditions. Common over-the-counter allergy medications such as diphenhydramine, Benadryl, nighttime pain relievers like Tylenol PM or Unisom, and prescription sleep aid options all contain anticholinergic ingredients. It's also found in common anxiety medications like hydroxyzine, Vistaril Atarax, which is often prescribed for anxiety or itching. And then there are the drugs for urinary incontinence, oxybutynin, ditropan, tolterodine, Detrol, and solifenacin, Vesicare, all of which apply the same mechanism to calm an overactive bladder. Even medications designed to reduce gut spasms in IBS, such as dicyclomine, Bentil, and patches used for motion sickness, like scopolamine patches, carry anticholinergic effects. These medications vary in potency, but they all share the harmful effect of suppressing acetylcholine activity. The impact isn't insignificant. A massive meta-analysis, including 1.5 million people, found a clear link between anticholinergic drug use and increased risk of dementia, including Alzheimer's disease. Moreover, the greater the exposure to these drugs, the higher the risk became. Another analysis pooling 21 separate studies showed that just 3 months of anticholinergic drug use elevated dementia risk by about 46% compared to non-users. That's nearly half the risk added from a single class of medication, and it comes on top of any genetic or lifestyle-related vulnerabilities a person may already have. Beyond the statistics, there is compelling biological evidence. Brain imaging studies reported in journals like JAMA Neurology show that anticholinergic medication use is associated with physical changes in the brain, including atrophy and lower metabolic activity. In other words, it's not just a temporary side effect. Long-term use can fundamentally alter brain structure and function. Understanding why this happens means looking at how acetylcholine works. In the brain, acetylcholine binds to muscarinic receptors in regions like the hippocampus and cerebral cortex, both of which are essential for learning and memory. By blocking these receptors, anticholinergic drugs interrupt the critical communication pathways responsible for memory formation, attention, and mental clarity. Though mild use might only cause transient issues like brain fog or slower reaction times, chronic exposure can lead to lasting harm. For older adults, this is especially worrisome. As we age, our natural acetylcholine production already declines, and reducing it further accelerates what might otherwise be an age-related memory decline. When you add multiple anticholinergic medications together, their combined effect can seriously impede brain function. What's the solution? First, awareness is key. Go through both prescription and over-the-counter medications you or your loved ones are taking. Research or ask your pharmacist or doctor whether each medication has anticholinergic properties. This is not about panic. It's about informed awareness. If you discover you're on anticholinergic drugs, don't abruptly stop taking them. That could be dangerous, especially with prescription medications. Instead, schedule a medical consultation to explore safer alternatives. Many symptoms treated by these medications can be managed just as effectively with options that pose less risk to the brain. If insomnia is your concern, you might try melatonin to help regulate sleep cycles naturally. Herbal remedies like ashwagandha, chamomile, or magnesium glycinate can promote relaxation without altering brain chemistry in harmful ways. If necessary, doctors sometimes prescribe medications like trazodone, which have minimal anticholinergic effects and are safer for long-term use. For allergies, switching from diphenhydramine to second-generation antihistamines like cetirizine, Zyrtec, loratadine, Claritin, or fexofenadine, Allegra, is a better choice. These newer antihistamines are designed to avoid crossing the blood-brain barrier and thus don't significantly impair cognition. Urinary incontinence can often be managed using mirabegron, Mirbatric, a completely different class of medication that doesn't block acetylcholine. IBS symptoms might respond to alternatives such as peppermint oil or non-anticholinergic prescription medications, depending on whether the dominant issue is constipation or diarrhea. Making changes feels intimidating, but even reducing your anticholinergic drug exposure in some ways can help. Work with your healthcare provider to evaluate your medication list and find suitable substitutes. In addition, there are lifestyle steps you can take right now to boost brain resilience. Move your body. Regular physical activity improves blood flow to the brain and supports healthy brain tissue. Stimulate your mind. Pursue mentally engaging activities. Reading, puzzles, learning a new skill, or social connection helps build cognitive reserve. Get quality sleep. Sleep restores neural connections and clears brain waste. Use good sleep hygiene to maintain deep restorative rest. Follow a brain-healthy diet. Foods rich in antioxidants, omega-3s, and fiber help overall health and support healthy acetylcholine production. Manage chronic disease. Control conditions like diabetes and high blood pressure to reduce additional dementia risk. Keep stress in check. Chronic stress raises inflammation and accelerates aging. Practices like meditation, yoga, or relaxation techniques can help. By pairing a medication review with mindful, healthy lifestyle habits, you starve off dementia before it even starts. You gain quality of life without sacrificing cognitive sharpness. It may feel overwhelming at first. Let me reassure you, most people do much better when they see how small changes can have big effects. You have agency. Even if you've been using these medications for years, it's never too late to protect your brain. Start by making one change. Have a conversation with your doctor about alternatives to any anticholinergic medications you're using. Replace one pill if possible. Then slowly build healthy patterns into your daily life. Move more, sleep better, feed your brain well. Ultimately, preserving mental acuity comes from awareness and small conscious steps. Now that you know how these medications might be affecting your brain, you can make better choices for yourself, for your loved ones, and for the decades ahead. Take care of your mind. It's your most precious asset.